Mrs. Smith is a 66-year-old patient attending your clinic today, complaining of poor fitting dentures and sore corners of the mouth. She has been wearing dentures, upper dentures, for the past 38 years. The current denture is 20-year-old. She has mentioned that the denture falls during eating and yawning. She has few remaining teeth on her lower jaw and doesn't want any lower jaw dentures. On examination, you find that the palate is red and inflamed, the upper denture has a broken buccal flange, and that all the teeth are worn out. Address the patient's concern, give diagnosis and management.
Here, the pointers would be that we address the diagnosis and etiology first. We emphasize on denture hygiene. We offer solutions for better occlusion and function. And we must also emphasize on review appointment after today's appointment to rule out any red flag lesions. Now, here's the role play. Hi, Mrs. Smith. Thank you so much for your patience while I was having a look at your teeth and gums. Are you feeling okay so far?
Yes, I'm feeling okay, thank you.
That's good. Now let's discuss what we've seen today. I do have a few questions with regards to your upper plate. Are you happy with the fit and the appearance? I can see that they were made a little while ago.
They're quite old, but I am able to manage with them. I don't really take them out much often, and I always sleep with them, so I guess it's working out fine for me.
Okay, that's true, but I have noticed the wear on the teeth, and I've also noted that it's broken in some places. We do need to discuss further about how to maintain these plates and so that they don't cause any other issues to your gums. Now, how long has this denture been loose for?
It's been loose for a while, but I've been able to manage and all that. But nowadays, it's falling more often, and I'm not really able to open my mouth for a long time.
Okay, that sounds quite uncomfortable to me. Did you have any modifications made to this plate in the past?
Nah. After 20 years of wearing a denture, I really didn't think that, I would have to go back, and I thought this was one with my skin now.
Right. No, I can see that, but you don't recall it ever being broken or repaired or anything done at all to that plate in the past?
No, just gone back to remove some lower teeth, but never really had anything to do with my upper denture after I got it done.
Okay. Now, when I was examining the plate, I also has seen some red spots on your roof of your mouth. Have you noticed them before?
No, no, not really. Like I told you, I always just wear my upper denture. I never remove it to see anything below it.
And you don't feel any soreness or any pain around that region at all?
Nor on the top, just around my mouth.
Okay. But you also did mention earlier that you had soreness around the corners of your mouth. How long have you had that for?
It's been, itchy for some time now, but it's been on and off. Nothing unbearable. But if it does go unbearable, or if I'm going out or eating something spicy,
Yeah.
then I put up some cream or some Vaseline on it and
And it
manage.
gets better?
For some time. Sometimes it's fine.
Okay. Now, I was also just thinking, do you wear a lower plate too? Do you have one?
No, never got a lower plate done. I lost my back teeth, but never bothered to get a plate done. It's not really seen when I speak, so.
Okay, so you did have one in the past.
No, I lost my teeth one by one,
Yeah.
and the doctor asked me to get one made, but then I was just happy with my upper teeth. I didn't think that I needed a lower one.
I see what's happening. So now the redness and the soreness of the gums, which I've seen today, this is called denture stomatitis. So this is a fungal condition, and it can come if you don't have improper, denture hygiene. So that can lead to this condition. But it's also likely that now that you're saying that this denture is loose and it keeps falling off when you're yawning or talking, it means that it's probably not the right fit anymore. And it's been a long time, teeth change, our gums change, our bones change. So it does appear to me at this point that this denture is not fitting you really well.
What do you mean? I always brush my teeth in the morning. I brush the denture teeth. I brush my own teeth. Do you think I'll get better?
Yes, of course, we will definitely do our best to put you out of discomfort, and we must really prioritize the healing of your gums and also alleviate the soreness that you have right now. But the first thing I would suggest today is to discontinue wearing the plate for a few days, and I'll give you a gel today which you can use to reduce your symptoms. The other thing I would suggest is you consider having a new plate made to fit the current condition of the mouth, because that way you will notice that it fits better, it seats well inside your mouth, and it will also help you with better functioning. All right?
Yeah, I'm okay with the new plate and all, but I'm not gonna leave my plate out at night. No.
No, I know it's a hard thing to do, a hard decision to make. And when you said that, you've had this for such a long time and it is a part of your mouth, it is quite natural for you to feel that way. But currently what's happening is that denture is preventing this particular spots that you have in your mouth from healing. So we do need to make sure that this heals. And so we do need to make sure that you aren't wearing the denture for a little while. And it's very important that you practice good denture hygiene. By that, what I mean is that you have to make sure that you maintain them well, you clean them well, and you leave it out to dry in the night. So this prevents any infections, and it also allows good healing of your gums and the tissues around the night time. I know it's hard. I know it's hard, but do you reckon you could incorporate this into your daily routine?
I guess I'll just have to wait for my husband to sleep, remove my dentures, put them back before he wakes up.
I know. I know. A lot of people say this to me. Believe me, Mrs. Smith. I know how you feel when you've been wearing this for so long. So now now that we're clear on working towards a good oral hygiene and good denture hygiene, I will also suggest that you consider wearing a lower plate as well. Now, there is a reason why I want you to do this, because I have noticed that there's a lot of wear on your lower teeth. This happens when you don't have good support from your lower arch, and in the long term what happens is these teeth will become loose and they'll get even more worn down, which means it's now weakening the support from the surrounding tissues.
Okay, I never really felt the need for a lower denture. I mean, I eat fine, I'm old, I eat soft food. I don't really need something down there as well. I'm just done with, wearing one on top all this while.
I know, and dentures are quite tricky that way, especially because you're having to wear them, take them out. It is not comfortable. I completely agree. But what happens when you don't wear a lower denture is your upper teeth will not be adequately supported by the lower teeth. So you will then notice that the folds are increasing in your face, which also causes the soreness, and that will also cause for your jaw to collapse a little. So this is why my recommendation would be that when we are designing an upper denture, we should go ahead and look at making a lower one as well.
You youngsters are always looking at changing everything. I guess I'll have to wear the lower denture now.
I'm sorry that you feel that way, Mrs. Smith, but yes, I'm glad you understood the importance of this. Now, just to reconfirm with you, are you taking any medications for any medical problems? Do you have any other allergies?
No, nothing, no allergies that I can think of, and nothing unless I get a fever or a cough.
Do you have any other habits like smoking or drinking?
Yes, I definitely smoke a packet a day, and I drink once in a while, probably over the weekends.
Right. So I understand that it's not easy to give up smoking, and I'm not asking you to do it straight away, but it does delay healing and it does affect our oral health. So my recommendation would be that if you could cut down on your smoking a little bit, and I'm happy to provide you with resources as well for the same.
Smoking? I've been smoking my whole life. I don't know if I can give it up. I will see if I can reduce it a bit. So.
I completely understand. Let's do our best to work towards, alleviating your symptoms and also helping you with quitting smoking as well. Now, the other thing that I wanted to ask you was, are you up to date with your checkups with the GP?
Yeah, I've been there probably 6-7 months back.
Any recent blood tests that you've had done?
No.
No, okay. So the reason why I want to emphasize on this is sometimes if you've got any vitamin deficiencies as well, they could reflect as soreness or ulcers in the mouth. So it's probably a good idea to touch base with your doctor and have a chat.
Have I'll contact him.
Great. Now, here's some literature for you to take home. This just details about everything that we've just talked about. It gives you all the advantages, disadvantages, maintenance, oral hygiene, all of it that we've just chatted about. Have a look at it. And, do you have any other questions for me?
No, I'm done. That's that.
Yeah. And we are now expecting that it would take about 2 weeks for us to see some improvement after following all these measures. I would definitely want to review you in 2 weeks' time to make sure that it's all healing and you're feeling better. So once we finish that, once I'm happy with what I've seen, we can then go ahead and start making the new dentures. Is that okay?
Yep, sounds like a plan.
All right. So let me just quickly write up the gel for you and we'll continue with this.
Thank you.